Welcome to this maternity risk assessment. This module discusses the obligation all employers have toward occupational health and safety of their staff, visitors, and any other person who may be affected by their scope of works, with particular regard to those within the organization who may require the use of maternity leave. Maternity in this context is defined as the period during pregnancy and shortly after childbirth. The purpose of this risk assessment module is to ensure that the most up-to-date information about the level of health risk posed to pregnant persons is available, to inform the risk manager, risk assessment team, and all employees of the necessary protocols and measures to be taken to prevent and mitigate the potential risks and hazards faced when working or learning within an environment that may expose them to the dangers as stated within this risk assessment. The goal of this risk assessment module is to be able to give the best information to the employer responsible for the pregnant person and the correct information to the pregnant person so that collectively they may make the best decision on the way forward with work, leave, and return to work procedures. This risk assessment is a guide and is not fully inclusive of all potential aspects, impacts, outcomes, or potential scenarios that each pregnant person will face or be exposed to. The risk assessment procedure that we will discuss forms part of the integrated risk management approach applied to the works performed by an employer. Sound and effective environmental health and safety risk management is a leading practice and a means of improving the performance objectives of the works going forward. Conducting a risk assessment is a legal requirement in terms of the Occupational Health and Safety Act 85 of 1993. The results of the risk assessment are to be made available to all interested parties and members of IOPSA, including any person who may be affected by the risks as stated below in the risk assessment. As we have seen, performing a risk assessment is a legal requirement. Let us take a look at this reminder under Section 8 of the OSH Act, Duty of the Employer. Every employer shall provide and maintain, as far as is reasonably practicable, a working environment that is safe and without risk to the health of his employees. Without derogating from the generality of the employer's duties under subsection 1, the matters to which those duties refer include in particular establishing as far as is reasonably practicable what hazards to the health or safety of persons are attached to any work which is performed, any article or substance which is produced, processed, used, handled, stored, or transported, and any plant or machinery which is used in his business, and he shall, as far as is reasonably practicable, further establish what precautionary measures should be taken with respect to such work, article, substance, plant, or machinery, in order to protect the health and safety of persons, and he shall provide the necessary means to apply such precautionary measures, providing such information, instructions, training, and supervision as may be necessary to ensure, as far as is reasonably practicable, the health and safety at work of his employees. The objectives of this maternity risk assessment plan is to firstly identify, analyze, and prioritize the health and safety hazards and potential unwanted events or risks associated with works in terms of exposure to danger. Secondly, identify engineering type mitigation strategies early. Third, provide information for improved costing associated with identified mitigation strategies. Fourth, produce and prioritize profile of potentially unwanted events associated with any scope of work performed by a plumber, such as a risk assessment. And lastly, develop a critical control management plan. Let us start off by looking at some definitions. Firstly, ALARP, as low as reasonably practicable. The concept of weighing the risk against the sacrifice needed and to implement the measures necessary to avoid the risk. In health and safety, it is assumed that the measures should be implemented unless it can be shown that the sacrifice is grossly disproportionate to the benefit. Consequence: the outcome of an event or situation expressed qualitatively or quantitatively, whether a loss, injury, health or environment impact or disadvantage, or a benefit, gain, or advantage. Control or barrier. Control or barrier is defined as anything used to control, prevent, or impede energy flow or the loss of control of a hazard. Types of barriers include physical, equipment design, warning devices, procedures, work processes, knowledge and skills, and supervision. Controls impact on the risk of the event, whether it is an opportunity or threat. It is essential to consider controls or barriers in terms of their order of greatest effectiveness. This order is known as the hierarchy of control. Critical controls. Those controls that significantly influence the likelihood and/or consequence of an event. If removed, they will significantly impact the risk rating. Event: an incident or situation which occurs in a particular place during a particular interval of time. Events involve releases or manifestations of or exposures to the hazard. Events can be wanted, opportunity, or unwanted, threat. Hazard: a source of potential harm to people, facilities, the environment, or the community that leads to unwanted damage. Understanding a hazard includes the nature, magnitude, and potential consequences, as well as relevant target or impact characteristics, potential timeframes, pathways or mechanisms of its manifestation, and residual harm. Also, understanding sources of harm to the community may require recognition of incentives. Likelihood: the probability or chance that an event will occur. Risk: a combination of the likelihood of an occurrence of a hazardous event or exposure and the severity of the impact. An example: injury, illness, environmental impact that may be caused by the event or exposure. Risk analysis: a systematic process to understand the nature of and deduce the level of risk. A maternity risk assessment will be carried out in accordance with leading practice for health and safety risk management. A qualitative risk methodology will be followed utilizing a risk assessment and control document as the risk assessment template. A risk determination matrix will be used for the evaluation of risks. We will be using one of the various risk assessment documents available. For more information on other risk assessment document types, please contact us at OHSS Consulting. Control effectiveness rating. The addition of control effectiveness consideration to the basic risk assessment control provides an opportunity to further discuss each control and the sum of all controls for an unwanted event. There are many ways to establish control effectiveness, ranging in complexity from simple to complex. A relatively simple method called the Control Effectiveness Rating, or CER, has been developed to generate and record subjective ratings of controls based on two dimensions: control type and control quality. Control type is based on the hierarchy of controls. Control quality offers percentage choices for control reliability and availability. A method of combining the two dimensions will be discussed. The control type in the risk assessment indicated by color will give general effectiveness of that control, where green is good quality or a very effective control, and yellow and red are less adequate. To understand the hierarchy of control, let us look at the definition of each. Elimination, the complete elimination of the hazard by design. Substitute, minimize, replacing the hazard, material or process with a less hazardous one, or significantly reducing the magnitude of the hazard or material so consequences are greatly reduced. Engineer, design in controls or redesign the equipment or work process. Separate, placing a physical barrier on the hazard by guarding or enclosing it. Administrate, providing control such as training and procedures. PPE, or personal protective equipment, use of appropriate and properly fitted PPE where other controls are not practical. Once the control type has been selected, then the control quality can be discussed. The quality of a control can be based on several factors. Reliability. Will the control operate on demand as intended? Survivability. Will the control remain unimpaired during the unwanted event? And availability. Will the control be available to perform its function? Control quality offers percentage categories for control reliability and availability. The control type in the risk assessment indicates by color the general effectiveness of that control, where green is a good quality or very effective control, and yellow and red are less adequate. Please open your copy of the IOPSA Maternity Risk Assessment Excel spreadsheet. You will notice 4 tabs. Tab number 1 is the document details. Tab number 2 is the description of the document. Tab number 3 is the matrix, and tab number 4 is the risk assessment. On the screen in front of you, you will have the risk matrix, which is highlighted in blue on tab number 3, as well as one line of the risk assessment. The risk matrix is made up of the probability index on the left-hand side, ranging from 0, not probable, to 5, almost certain to inevitable, with 4 severity indexes. The first severity index is on injury, where 0 is a near miss, 1 is only a first aid case, 2 is less than 14 days of injury with complete recovery, 3 is medical attention with more than 14 days to complete recovery, 4 is permanent to slight disability, and 5 being fatal. The second severity index is on production, with 0 being no lost time, 1 being a lost time of 1 man shift, 2 a lost time of 1 day of production, 3 a lost time of 1 week of production, 4 a loss of 1 month or more of production, and 5 no production at all. The third severity index is on the working environment, where 0 is no aspect or impact. 1 would be an insignificant effect. 2 would be short-term, 1 day to 6 months. 3 would be a medium impact of 6 months to a year. 4 would be long-term, more than 2 years. And 5 permanent effects on the working environment. The fourth and last severity index is the cost index, where 0 is no cost at all, ranging up to 500,000 to 999,999. Lastly, we have the frequency index, where 0 is no hazard existing, to 5 the hazard permanently exists. Now notice the bottom section of the slide. This is one line item of your risk assessment. First, we need to identify what is the task, activity, or piece of equipment that you are working with. Secondly, we need to identify what is the source of exposure to danger or hazard. Thirdly, we would want to know what is the associated risk related to the hazard. Please note that some hazards will have multiple associated risks, and so we want to isolate each risk separately. This means you may use 3 or 4 or even more lines underneath this section in order to isolate each risk associated with one specific hazard. The next section is identifying the impact of this hazard or risk. Does it impact your health, your safety, or the working environment, or two, or all three? We then look at the risk matrix. The risk matrix helps us to understand what is going to be the actual impact of that risk before we have implemented any controls. In this case, the probability of walking up or down stairs and it causing a slip or trip is at a level 4. This means it is a probable risk. The severity index, broken up into injury, production, environment, and cost, are rated 4, 3, 0, and 4. That is because if you did slip while walking up or down stairs, the severity index on injury would be 4, permanent to slight disability. Yes, you could get very injured when slipping or tripping up or down stairs. The severity index on production would be a 3, the loss of at least 1 week of production due to implementing some sort of assessment as well as investigating the incident in order to ensure that this does not occur again. And so production for that week or that section of time would be hindered. There will, however, be no index or no impact on the working environment, and so there is no aspect or impact that we have isolated there. The cost, though, is very high. From 100,000 to 500,000 Rand is the estimated cost of this type of incident. So the risk score, how do you get 35% from this? Well, there's a very, very simple mathematical algorithm that you would want to use, and it is noted right underneath the severity index. You will notice it says 4 times the sum of severity, which is 11, times 4. How do we get those figures? Well, 4 would be the probability index. The sum of the severity would be the total added amount of each severity index, which would be 4 for injury, 3 for production, 0 for environment, and 4 for cost. 4 plus 3 equals 7, plus 0 equals 7, plus 4 equals 11. That is the sum of the severity. And so we take the probability, 4, times 11 gives us 44, times our frequency, which is also 4. This gives us a total of 176. We now need to divide this by 500 and times it by 100 in order to give us a percentage of risk. This brings us to 35.2, rounded out in the risk matrix as 35% chance of slipping or tripping when walking up or down stairs when entering a workplace. This gives us a risk rating of yellow. This means there is something we can do to control the risk. Remember, we want to use the hierarchy of control to prevent this risk from occurring. Can you eliminate this hazard? Could you stop walking up or down stairs to enter your workplace? No. But what we can do is reduce and control the risk. The first control here is to use the handrails provided. This is an engineering method to provide a more stable working environment up or down those stairs. We also never want to forget the COVID implications of hands touching handrails. And so sanitizing after using a handrail and not touching your face, nose or mouth with unwashed hands is also a protocol that we want to manage. Then never walk up or down stairs with items in your hands, as well as having a clear line of sight up or down the stairs. This means that housekeeping, as well as ensuring that any type of lifting or carrying is monitored crucially when done up or down stairs. Now that we've put our control measures in place, we can reassess the risk. This is because the initial risk, without any controls, is very high. And what we want to do is reduce and manage our control. And so the probability index, severity index, and frequency index may change based on the new controls that we have implemented, giving us a new risk score of 10% or green. This is really where we want to take all risks. Why not try and have a look at the risk assessment and see if you can design another task, general activity, or equipment used by pregnant persons in the workplace and see if you can identify the hazard, the associated risk, and work out what the risk score or risk rating would be in your working area. Never forget that when we work out the controls, we always want to try and work in accordance with the hierarchy of controls, which we'll remind you about now. A green control rating indicates that the control should be very effective. This is, of course, the desired effectiveness of each control. But the design matrix indicates that even at 75% quality, administrative or PPE control is not considered to be an effective control. The intent of this design is to promote the development and application of harder controls, such as engineering or substitution. A yellow control rating indicates a satisfactory control that could be improved to a green either through improving its quality or by changing its type. Yellow controls should be improved if total control effectiveness for an unwanted event is inadequate. A red control rating indicates that the control does not contribute effectively to reducing the risk of an unwanted event. Pregnant employees are considered part of a vulnerable employee group due to inherent risks to the pregnant person and the unborn fetus or baby. The complexity of fertility, pregnancy, and the postpartum period and the large number of variables makes it impossible to present sharply defined criteria that can be applied with precision. The document and subsequent risk assessment propose to offer a structural framework for the application of sound clinical judgment. The pregnant worker desires to continue to work as long as they are reasonably able to do so, without undue risk to themselves, their fetus, or others. The employer values the pregnant person as an employee and is concerned with their well-being. The employer, therefore, will desire that they continue working as long as they can reasonably do so without risk to themselves, their fetus, or others, and will arrange any reasonable modifications of the job that will enable them to continue working. The first trimester. The degree to which the symptoms of early pregnancy affect the individual is quite variable, and often is influenced by the general health and psychological state of the pregnant person. Nausea and vomiting may be absent or may be severe enough to warrant hospitalization. Some fatigue is almost always present. Headaches and increased frequency of urination are less common. In the second trimester, increased mobility of symphyseal and sacroiliac joints become apparent, and the pregnant person may increasingly experience lower back discomfort and stiffness. Weight gain of about 7 kilograms is usually reached by the end of the second trimester. The gastric emptying time is delayed and constipation is common due to hypomotility of the entire gastrointestinal tract. At about the 4th month, the uterus dilates and becomes hypotonic, probably secondary to the generalized smooth muscle relaxation due to increased levels of progesterone. Many women experience dizziness, and some have syncope with prolonged standing or working in hot environments. This is attributed to decreased cardiac output resulting from lowered venous return from the legs and the dilation of peripheral vessels to dissipate body heat. Almost all of the physiologic effects of pregnancy have stabilized at their new levels by the end of the 2nd trimester and continue relatively unchanged until term. The major changes noted are the progressive enlargement of the uterus and the reaching of an average total body weight gain of 11 kilograms. There is a tendency to retain fluids. Peripheral edema is frequently present, reflecting decreased venous return from the legs due to the pressure of the uterus on the pelvic veins. Fatigue, dyspnea, and insomnia result from the combination of the effects of weight gain, the increased respiratory requirements, with an increasing tendency toward an oxygen debt, and the general discomfort of managing a relatively more bulky and awkward body. Balance and equilibrium become problems in most activities. General myalgia, due to stretching of the abdominal musculature, may occur. The use of unfamiliar muscles to maintain balance and the relaxation of pelvic ligaments may also result in lower back pain. When designing your maternity risk assessment, please have a look at the following hazards. Physical, such as working at heights, where the potential to fall, even wearing a harness as this could induce suspension trauma, may affect the pregnant person. This could also have a psychological impact during the pregnancy. If a medical stated that you were psychologically fit to work at heights, but this changes during the annual renewable period, then the medical would essentially be voided. Also, working in a confined space, such as sewers, manholes, and tanks, can all increase the likelihood of potential confined space hazards and risks. Biological waste or stagnant water can be an immediate threat to your health and the health of the unborn child. Although any person may be at risk of contracting COVID-19, certain groups of people are at higher risk of developing serious complications and severe illness if infected with a virus. At risk are employees that are more than 28 weeks pregnant, especially in combination with any of the following conditions: chronic lung disease, diabetes, moderate or severe hypertension, serious heart conditions, chronic kidney disease being treated with dialysis, chronic liver disease including cirrhosis, employees with severe obesity, a body mass index of more than 40%, and employees that are immunocompromised. Hazardous chemical substances. The use of chemicals can create the risk of inhalation, ingestion, or skin contact hazards depending on the type and quantity of hazardous chemical substances being used. Even some chemicals deemed non-hazardous may cause adverse reactions depending on the pregnant person's body changing as a result of being pregnant. Ergonomic hazards. Bending, reaching, squatting, lifting, or crawling are all potential dangers for pregnant persons, especially as they move closer to the 2nd and 3rd trimester, and until these awkward positions become hazardous to the unborn child. The use of power tools, pneumatic tools, or operating machinery have noise and vibration-related hazards that can impact the pregnant person and the unborn child. Workplace environment hazards such as temperature, lighting, and ventilation will impact the pregnant person in different ways and also at different times of pregnancy, all posing a threat on the pregnant person and the unborn child. Lone working, excessive hours, or overworking Stress and traveling to and from work all pose a workplace environment hazard that can create various unwanted situations that can impact the pregnant person. Radiation hazards. These hazards come from the use of welding or soldering equipment, the use of certain metals, and exposure to flames, smoke, or other forms of radiation-emitting works. Then there are pregnancy hazards. These types of hazards are different for most persons. However, there are hazards that most will experience, and these need to be taken into consideration. Stress related to pregnancy may even start from the first day of a person finding out that they are pregnant. They may start to become concerned or overly anxious with the future events. Thus, the need to start learning about pregnancy hazards and risks before falling pregnant is essential. Every person who is wanting to get pregnant needs to be aware of the danger signs that occur during pregnancy, as complications can be unpredictable. These danger signs include vaginal bleeding, severe headache, vision problems, high fever, swollen hands or face, and reduced fetal movement. These danger signs usually indicate the presence of an obstetric complication that may arise during pregnancy, delivery, or post-delivery. Knowledge of these danger signs will help persons to make the right decisions and take appropriate healthcare-seeking actions. Eventually, taking the right healthcare-seeking action means receiving immediate and appropriate care, which reduces maternal mortality and morbidity. Therefore, employers responsible for anyone who falls pregnant and the person who wishes to fall pregnant should receive health education about pregnancy, including outcomes, danger signs during pregnancy, nutrition and family planning, and any other information as is deemed necessary by the healthcare provider. Remember, pregnant persons who smoke or continue to smoke are allowing their fetus to smoke too. The smoking person passes nicotine, carbon monoxide, and many other chemicals to their growing baby. Likewise, you should avoid people who are smoking, whether they are co-workers, friends, family members, or people in public places. Here are 4 common pregnancy complications by Johns Hopkins. The following common pregnancy complications may have an impact on the pregnant employee's ability to perform required duties at the same level of performance pre-pregnancy. Accommodating the pregnant employee with temporary alternative employment may be required. Excessive morning sickness, hyperemesis gravidarium or HG. While many pregnant persons experience morning sickness, nausea, possibly with vomiting, generally in the morning hours, and other discomforts during pregnancy, persons with hyperemesis gravidarium, HG, have morning sickness times 1,000. HG is a severe nausea that results in significant weight loss and may require hospitalization. This condition cannot be prevented, and it can lead to the pregnant person and the fetus not getting enough nutrients. Regular prenatal care is crucial. Many pregnant persons start to feel better by the 20th week of pregnancy, while some continue to experience symptoms throughout the entire pregnancy. What is it? While many pregnant persons experience morning sickness and other discomforts during pregnancy, persons with HG have morning sickness times 1,000. HG is severe nausea that results in significant weight loss and may require hospitalization. What are the symptoms? Pregnant persons with HG have severe nausea and vomiting. The vomiting and reduced appetite leads to weight loss and dehydration. The major difference between HG and normal morning sickness is that HG results in a weight loss of 5% or more of your pregnancy weight. Who is at risk of HG? Doctors do not yet fully understand HG, what causes it, or who is more likely to experience it. Can you prevent HG? You cannot prevent HG, but you can take steps to control and manage it during your pregnancy. The most important thing you can do for you and your baby is to get regular prenatal care. HG can lead to not getting enough nutrients, which can be harmful to both you and your baby. However, with proper treatment, there are typically no long-term effects to either pregnant persons or child after the pregnancy. How is it treated? If you have been diagnosed with HG, the priority is to ensure you have enough nutrients to keep you and your baby healthy. For some pregnant persons, a diet of bland foods and fluids may be enough, while others may need to take medication to help relieve the nausea. In severe cases, you may need to be hospitalized to receive nutrients and fluids via intravenous or IV line. You may feel down about having to be in the hospital during your pregnancy, but remember that you are just doing what you need to do to protect your and your baby's health. Many pregnant persons start to feel better by the 20th week of pregnancy, while some continue to experience symptoms throughout the entire pregnancy. So what should you ask your doctor? If you've had HG in the past, talk to your doctor when you are thinking about getting pregnant again. It's important to make sure that you are physically, emotionally, and psychologically ready to begin another pregnancy. If you have had severe weight loss or other nutritional deficiencies, you'll need to talk to your doctor about making sure you are healthy before getting pregnant. Gestational diabetes mellitus, or GDM. GDM is a type of diabetes that occurs during pregnancy. One of the biggest risks of gestational diabetes is that your baby may grow much larger than normal, a condition called macrosomia. During delivery, a baby's shoulders can get stuck. If the baby is thought to be too big for a safe vaginal delivery, the doctor will recommend a cesarean section. Risk factors for gestational diabetes include being overweight or having a history of GDM in previous pregnancies. If at high risk, the doctor will screen for GDM earlier than 24 weeks, typically in the first trimester. Diabetes is a condition that prevents your body from breaking down sugar. GDM is a type of diabetes that occurs during pregnancy. One of the biggest risks of GDM is that your baby may grow much larger than normal, a condition called macrosomia. During delivery, a baby's shoulders can get stuck. If the baby is thought to be too big for a safe vaginal delivery, your doctor will recommend a cesarean section. What are the symptoms? GDM has no outward signs or symptoms. Doctors screen for it between 24 and 28 weeks of pregnancy, or earlier in high-risk pregnant persons, such as those who are overweight or who have a history of GDM. Who is at risk? Risk factors for GDM include being overweight or having a history of GDM in previous pregnancies. If you are at high risk, your doctor will screen for GDM earlier than 24 weeks, typically in the first trimester. Can you prevent it? Losing weight before pregnancy, sticking to a healthy diet, and getting regular exercise can lower your risk of developing GDM. How is it treated? You and your doctor should discuss how you can best control the GDM. Good old diet and exercise seem to be a good place to start. A very high percentage of GDM can be controlled by diet. Still, some pregnant persons with GDM will need to take medications, pills or even insulin to control blood sugar levels. Exercise during pregnancy, even just walking 30 minutes a day, is also great for controlling blood sugar. It's best to do something you enjoy so you'll stick with it, but you should let your doctor know what type of exercise you are doing. What should you ask your doctor? If you've had GDM, you and your baby are both at risk of developing type 2 diabetes later in life. So talk to your doctor about steps you can take to reduce that risk. Placenta Previa. The placenta provides the baby with oxygen and nutrients for proper development. The placenta normally attaches to the upper part of the uterus, but in Placenta Previa it is either totally or partially covering the cervix, which is the opening between the uterus and vagina. The main symptom is vaginal bleeding that is not accompanied by cramping or other pain. Some pregnant persons, however, do not experience any symptoms. The doctor will confirm a diagnosis using an ultrasound or physical exam. Placenta previa may result in bleeding during pregnancy. Some pregnant persons have no bleeding, some have spotting, and others may experience heavy bleeding. If the bleeding is heavy, it may be required to stay in the hospital for a period of time. Pregnant persons with placenta previa will require a C-section to deliver the baby, usually scheduled 2 to 4 weeks before their due date. While you are pregnant, the placenta provides your baby with oxygen and nutrients for proper development. The placenta normally attaches to the upper part of the uterus, but in placenta previa, it either totally or partially covers the cervix. Who is at risk? You may be at higher risk if you have scarring on your uterus from previous pregnancies, or from a uterine surgery, or if you have fibroids. What are the symptoms? The main symptom is vaginal bleeding that is not accompanied by cramping or other pain. Some pregnant persons, however, do not experience any symptoms. Your doctor will confirm a diagnosis using an ultrasound or physical exam. There is nothing you can do to prevent placenta previa. However, you can increase your and your baby's health by getting regular prenatal care. If you are at high risk because of a previous surgery, C-section, or fibroids, make sure to tell your doctor. They may want to monitor you more closely during your pregnancy. How is it treated? Placenta previa may result in bleeding during pregnancy. Some pregnant persons have no bleeding, some have spotting, and others may experience heavy bleeding. If the bleeding is heavy, you may need to stay in the hospital for a period of time. Pregnant persons with placenta previa will require a C-section to deliver the baby, usually scheduled 2 to 4 weeks before their due date. So what should you ask your doctor? Always talk to your doctor if you notice any vaginal bleeding at any point during your pregnancy. Pre-eclampsia. Pre-eclampsia is a condition that causes dangerously high blood pressure. It can be life-threatening if left untreated. Pre-eclampsia typically happens after 20 weeks of pregnancy, often in pregnant persons who have no history of high blood pressure. Symptoms of pre-eclampsia may include severe headache, vision changes, and pain under the ribs. However, many pregnant persons don't feel symptoms right away. The first alert is usually when a pregnant person comes in for a routine prenatal visit and has high blood pressure. Regular prenatal visits are the best way to control pre-eclampsia. The condition only goes away once the baby is born, so delivery is the best way to treat pre-eclampsia. Pre-eclampsia is a condition that causes dangerously high blood pressure. It can be life-threatening if left untreated. Pre-eclampsia typically happens after 20 weeks of pregnancy, often in pregnant persons who have no history of high blood pressure. What are the symptoms? Symptoms of pre-eclampsia may include severe headache, vision changes, and pain under the ribs. However, many pregnant persons don't feel symptoms right away. The first alert is usually when a pregnant person comes in for a routine prenatal visit and has high blood pressure. In those cases, your doctor will test for things like kidney and liver function to determine whether it is pre-eclampsia or just high blood pressure. So who is at risk? Risk factors for pre-eclampsia include having a history of high blood pressure, being obese, having a body mass index or BMI greater than 30, Age. Teenage persons and those over 40 are at higher risk. And being pregnant with multiples. Can you prevent it? While you can't prevent preeclampsia, staying healthy during your pregnancy may help. If you have risk factors, experts recommend that you see your obstetrician either before you become pregnant or very early in your pregnancy, so you and your doctor can discuss ways you can reduce your risk. For example, many pregnant persons at risk for preeclampsia are prescribed a baby aspirin after the first trimester. Regular prenatal visits are the best way to control preeclampsia. During those routine visits, your doctor will check your blood pressure. If it is high, further tests can diagnose the condition so you can start getting the treatment you need. How is it treated? The condition only goes away once the baby is born, so delivery is the best way to treat preeclampsia. However, delivering the baby too early can put the baby at risk for health problems. The decision about how to treat you will largely depend on how far along the pregnancy is. You may need to be hospitalized so your team can monitor you and your baby closely. So what should you ask your doctor? Your doctor will discuss the risks and benefits of delivering the baby early versus continuing the pregnancy and trying to manage the preeclampsia as long as possible through other methods. After delivery, the condition will go away, but you will be at greater risk for heart disease later in life. Talk to your doctor about what you can do to help reduce and manage those risks. A good reminder: when determining the best and safest solution for pregnant persons at work, always use the hierarchy of controls to ensure adequate and sufficient risk mitigation. To understand the hierarchy of control, let us look at the definition of each. Elimination: the complete elimination of the hazard by design. Substitute, minimize: replacing the hazard, material or process with a less hazardous one, or significantly reducing the magnitude of the hazard or material so consequences are greatly reduced. Engineer: design in controls or redesign the equipment or work process. Separate: placing a physical barrier on the hazard by guarding or enclosing it. Administrate: providing controls such as training and procedures. PPE or personal protective equipment: use of appropriate and properly fitted PPE where other controls are not practical. We really hope that you understand what a risk assessment really is. Identifying what is the hazard or source of exposure to danger. Now have a look at the risk assessment you currently have in place and manage it along with the newly pregnant person in your workplace. If you are the pregnant person or the employer of the pregnant person, why not sit down and take a look at your risk assessment and manage the change that has now occurred? Could some physical work that is being performed by the pregnant person generate a newly foreseen hazard? Take a look at the risk assessment line in this slide. The task here is physical work, such as digging, excavation, or manual labor. For a pregnant person, the identification of the hazard would be ergonomic, such as prolonged sitting or standing while performing physical work. Sitting or standing for long periods during pregnancy can have serious health consequences. Standing for long unbroken periods can result in complications during pregnancy, such as deep vein thrombosis, varicose veins, premature labor, and even miscarriage. This will have a deep impact on both health and safety of a person. Notice that the probability, severity, and frequency are relatively high for this specific task. But control measures can be implemented to assist you in ensuring this pregnant person can mitigate risks. Workstations should be adjustable to allow for necessary changes in posture. Pregnant employees who sit for long periods should be provided with a proper chair with lumbar support, as well as rest to prevent back pain. A footrest could alleviate pain and discomfort in the case of both sitting and standing workers. Pregnant employees who work in stationary positions should be given frequent rest breaks. Mobility during breaks should be encouraged to help prevent swelling of the ankles and improve blood circulation. Where work organization permits task rotation, this should be done in order to allow the worker to do tasks that involve standing, sitting, and moving. What about the other controls to mitigate things such as digging, excavation, or other types of manual labor? Can you think of any and then complete the rest of this risk assessment?